In a fast-paced clinical setting, understanding nursing theory is only half the job. The real test is translating textbook knowledge into hands-on practice. To provide safe, effective care, you need to master 4 essential protocols: establishing strict asepsis, engineering a safe bed, stabilizing injured limbs with slings, and optimizing the patient's room for recovery. But before you ever make direct contact with a patient, preparation comes first. Securing your personal protective equipment and verifying your sterile supplies prevents a cascade of safety failures down the line. This text details the standard for surgical asepsis. It defines it as the complete absence of all organisms, including pathogens and spores, from an object. You will mandatorily practice this in operative rooms, labor and delivery, and diagnostic areas. Before opening anything, verify every sterile package is clearly labeled with its contents and expiration date. Never assume sterility. When opening, direct wrapper edges away from yourself to prevent contamination before donning your gown, gloves, and mask. Once established, strict boundaries apply. Keep all sterile equipment and hands above waist level. Never turn your back on the field, and aggressively prevent air currents by avoiding speaking, coughing, or making fast movements with clothes or drapes. Asepsis operates as a binary state. There is no such thing as being partially sterile. A single broken rule compromises the entire procedure and directly endangers the patient. With a sterile environment maintained, we shift to room preparation. We will focus on preparing an open bed, designed specifically to welcome an incoming client. When stripping the previous bed, use solid body mechanics. Roll soiled linens inward toward the center, placing them directly into the laundry hamper. Never shake them to avoid spreading microorganisms. As you apply the new, clean linens, pull the bottom sheet completely taut across the mattress. This principal document highlights why. A well-made bed must be free of wrinkles. Even minor folds create friction and pressure points against the skin, rapidly developing into debilitating bed sores. Proper bed making is an active medical intervention. A tightly secured, wrinkle-free surface is essential for maintaining your patient's skin integrity and overall comfort. Next, we look at physical stabilization. This note outlines the primary purpose of an arm sling, providing immediate support and immobilization when there are injuries to the upper limbs or chest. Have the casualty sit down, supporting their injured forearm so the wrist rests higher than the elbow. Slide the triangular bandage between chest and forearm. Drape the upper end over the sound shoulder and around the back of the neck. Bring the lower end up over the forearm and tie the 2 ends using a secure reef knot. Never tie this directly over the spine. Place it in the hollow above the collarbone. Finally, leave the fingers exposed to check circulation. Applying a bandage correctly requires balancing firm support with uncompromised circulation. If immobilization creates a secondary complication like blood loss, the intervention has failed. Recovery requires rest. Sleep is a condition of decreased activity vital for healing. Before a patient can achieve it, you must manage physical distress, pain, or immediate needs like the urge to urinate. Once physical pain is managed, actively control the room's environment. Adjust the temperature so it isn't too hot or cold, and ensure proper ventilation. Next, audit the space for secondary disruptors. Dim harsh light levels, minimize loud noises in the corridor, and reduce unfamiliar stimuli that cause anxiety. Internal factors like emotional stress, combined with the irregular schedules of a hospital ward, also severely inhibit a patient's natural ability to fall asleep. Excellent care extends past the physical body. Curating a quiet, sensory-optimized room is an active prescription for their overall recovery. By following these core protocols, from strict surgical asepsis to precise environmental control, you elevate the patient's environment from risk to clinical readiness. Practice these exact protocols repeatedly. Your sterile technique, bed-making precision, and bandaging methods must become deeply ingrained muscle memory. Mastering these fundamentals is non-negotiable. These procedures prevent the secondary complications, like infection and skin breakdown, that often interfere with more complex medical goals.